Good morning, everybody. So I think it's truly my honor to be standing here. In fact, maybe this is the first time to stand on the international stage to show my case. So today I will just show you a case in aesthetic zone, and this case just accept immediately implant placement with connective tissue graft. And here is it's a 41 years old woman present to the clinic and with a primary concern about the mobility and a slight inflammation around the maxillary right incisor. After the clinic evaluation, we found that this tooth just had a grade 2 mobility, and we can see that there was a chronic inflammation surrounding with the margin. And besides, we can see that there is a slight of the middle buccal mucosa recession. And for this kind of the patient, and we know that sometimes they have just a very high expect. They just expect to accept immediately implant placement and restoration if possible. Of course, the patient is a young woman. She just wishes to have a high aesthetic results. For this kind of patient, we know that we need to do the first thing is a good plan. And there are 5 keywords we need to consider when we do the plan if we want to achieve a good or better aesthetic results. And we know that the timing, we know that immediately implant placement, this procedure or this approach is defined. We just insert the implant inside of the extraction socket immediately after the tooth extraction. But we know that the immediately implant placement can shorter or reduce the treatment, the surgery procedure, and shorter the treatment time. But already we know that we need to select the patient very carefully. That's because, the patient should be the indication. Indication should be under the indication of the implant immediately placement. And we just emphasize that aesthetically, a position of the implant is required. That's because it can help to maintain the soft and hard tissue. And we know that if the wrong position of the placement of the implant may be lead to the aesthetic complications. And we also know that the future restoration and the soft tissue level just determined by the 3D of the implant position. And we also know that the implant depth just determined the ideal length of the crown, right? So we just emphasize the correct position of placement. And we also know that once the tooth has been extracted, the buccal bone starts to absorb. So we need to do the bone augmentation at the same time of the dental implant. And we also emphasize that, the adequate design of the restoration is needed. That's because we know especially the transgingival area should be designed. Why? That's because it should be developed to maintain our influence of the final presentation of final appearance of the soft tissue. So, I think the design of the restoration is a really tough and very important task for our clinicians. That's because we need to do the good design to achieve very stable and optimal outcomes. But even if we just have done very well the first 4 key steps, in fact, immediately implant placement, maybe is ability to predict the final soft tissue level. So what should we do to just reduce the soft tissue changes? Just as we know that the soft tissue augmentation kind of a good choice. But our question is that does the soft tissue augmentation just can help to reduce the soft tissue changes? So we need to just consult the literature to find the evidence-based support for us if the soft tissue augmentation is helpful or not to maintain the soft tissue changes, right? So in fact, the first thing we worry about, the primary worry about the soft tissue changes after the immediate implant placement is what? It's middle buccal mucosa recession, right? So my question is that is the CTG graft is helpful to maintain or just reduce the middle buccal mucosa recession? So we can just find the answer from this lecture with RCT. It just can give us a conclusion is that after 1 year follow-up, you can see that the connective tissue graft combined with the single immediate implant placement has a less middle buccal mucosa recession. That is good, right? So much more from this systematic review with up to 74 citation also can give us this conclusion in that we can see that the middle facial vertical soft tissue changes or recession is 12 times lower following immediate implant placement with CTG compared with the group without CTG. So it's also recommended that, especially in the patients with thin gingival bell type or the patient have a buccal bone thickness less than 0.5 millimeters, it's recommended to have CTG when they just accept the immediate implant placement. So another thing we just worry about the soft tissue changes is that does the CTG graft can just help us to get much more increase the soft tissue thickness or maintain the soft tissue thickness and have a better profile outcomes. In fact, we can say if we think up to 2 years follow-up is not enough to indicate a long-term stability of soft tissue magnetization. Here is another CTG with a 5 years follow-up. We can see that compared with the baseline after 5 years follow-up, the soft tissue thickness got 0.3 millimeters increase. And at the meantime, we can see that the rate counter changes compared with the original level. The group with CTG only got 0.3 millimeter decrease. That just give us a conclusion is that if the implant site just have the procedure, underwent the procedure with the augmentation of the soft tissue, can have a long-term stability of the soft tissue surrounding the implant. So with this very useful information, we just back to the clinical case. In fact, finally, the case just accept those procedure. First of all, we just do the extraction, minimal invasion extraction. I do the immediate implant placement and the CTG, bone augmentation, and accept the restoration, immediate restoration. And up to today, it has also more than 1 year follow-up. Just as the patient personally said, she just very satisfied all the whole treatment process and the aesthetic outcomes. Okay, let's just review the whole treatment in detail. First of all, we need to do the minimal invasion extraction. And in this step, we just emphasize that the use of the minimal invasion extraction instruments to ensure the integrity of the buccal bone. Besides, we just emphasize that we need to what? We need to keep the integrity of the gingiva margin, especially without any tearing in the papilla area. Once the tooth had been extracted, just according to the 3A, 2B rulers, we know that the implant should be placed just 3 millimeters apical and 2 millimeters in the palatal position to ensure the implant has been positioned in a correct way. And in this case, the implant is placed with a high torque. After that, we just make a superior envelope flope is prepared, and we know that the superior envelope flope can just help us to what? To preserve the original existing the gingiva. And we know that this is the minimal evasion surgery on the recipient area, and a very firmly fixture of the CTG, and to help them to survival. And the intimate contact with the biolaminar or the soft tissue complex just achieved, and this permits and help to maintain and help to formation of the graft survival and the post-operating bleeding of the soft tissue. So once this step is done, we just harvest the connective tissue graft from the palatal. The first step is that we use it to de-epithelial by using a high speed rotating bar, and then we just tracing the graft with the tips of the blender. Why we just use this method? That's because this method can guarantee we can get a free CTG with a very high dense connective tissue layer. Then next step, we can trim the final shape according to the need of the recipient area. Then next step, we just firmly suture the free CTG, an internal accept of the flap, and just in the perio-marginal area position. And the next step following, we just put some bone particles, biomaterials inside of the bone counter and under the mucosa margin. Here is another. Here is the immediately the restoration. Just as what we mentioned in the last presentation, we already know that there is the two distinct area can be identified. And the first one is the critical counter, and the next one is the subcritical counter with a S-curve. Why we should just design the surface just like in this shape? That's because there will be a regeneration space can be created between what? Between the surface of the restoration and the soft tissue. And this space just can permit the formation of very stable blood clot just in combined with the soft tissue we just insert into it and the bone particles. And we can see the clinic outcomes. Just after 1 year follow-up, we can see that with the help of the restoration design and with the CTG graft, we can see that the merging of the soft tissue just can be maintained very well. And besides, another very interesting finding is that we can see that this is X-ray pictures before and after, compared to the original bone counter. You can see, in fact, after 6 months post-operation, in fact, there is a slight resorption of the bone buckle. But we can see from the clinic pictures, we can see that even after 1 year post, the soft tissue contour has no changes at all. That is why I think everybody already get the answer. That's because we said that with the CTG, with the soft tissue graft augmentation, and with the especially design of the restoration, give the soft tissue regeneration possible and the area. So all of those tries just compensate the buccal bone resorption. Okay, that's all. That's the case today. Thank you for your attention, and welcome to China. We just expect one day we can just communicate with the connective tissue graft in China one day. Thank you so much.
Thank you.